Do you know if there's anything additional, Dr. Chung, that we should be doing in terms of measures in place to protect employees now that are in the essential environment or those that, could be reentering? Is there anything, more that we could be doing besides the risk management and the education piece?
Right. Again, and I want to reinforce the concept of a risk assessment, right? In addition to the basics, including social distancing, maybe wearing some type of face covering to minimize as I would say, the debris field. Maybe you should reassess whether you need everybody at the workplace and whether you can reduce the numbers and things like that. And then as part of the risk assessment, you need to identify, what's the opportunity because you're an essential business of meeting the public, let's say, or that there are opportunities for the virus to be around. So there's some engineering controls, maybe having a shield in a process flow so that people are going one way and not kind of cross-contaminating because they're walking towards each other, that everybody should be flowing in one direction. There are, recommendations such as increasing the ventilation rate or the air exchange rate to kind of move some of the, microspace sprays off of the area. So, so there are a variety of things, and it all starts with, the employer's need for a risk assessment to identify those. The other part, of course, I think Shannon and I have talked about this a little bit, is cleaning. Cleaning measures are going to be very important, especially of the high touch areas, the elevator buttons, the doorknobs, the handrails that everybody else touch, and you just don't know who is, infectious or not. And then there's some self, hygiene issues, not so much you as an individual, other than, of course, hand washing and don't touch your face, but also if you were to use a certain chair or conference room table where it's shared, it's almost like going to the gym, right? You really should wipe it down before you use it, and you should wipe it down after you use it so that you minimize that fomite or inanimate object transfer.
Thank you. That's a really good analogy. I think a lot of people will be able to put into play the gym analogy. So thanks for that. I know a lot of us are looking forward to getting back to one. So hopefully we'll practice those. Uh, Dr. Magari, is there anything else you'd like to add to this particular question?
I think that was a great answer. I would add, since buildings have been unoccupied maybe for weeks, when this is over, we're not really sure when everyone's going back necessarily, but just to do some good house cleaning and really think about general indoor air quality. Dr. Chung had alluded to some of the air and HVAC kinds of considerations. Those are things we're helping clients think about now. What does reopening an office space look like? What does reopening a manufacturing facility look like? Things happen when buildings sit empty for weeks on end. We also want to make sure that, the softer side of things are addressed with employees when they're back to work. I think when this is all over with, everybody's going to have a different definition of clean. And we need to be sensitive to that for our employees.